So hello, my name is Dorothy Salenti. I am from UNC Chapel Hill, the Gilling School of Global Public Health, and I have the honor to open the meeting this morning. I am one of the collaborative leaders of the Maternal Health Learning and Innovation Center. We use a collaborative leadership model, so we have many partners here and others from UNC who you'll be able to meet throughout the two-day meeting. The Maternal Health Learning and Innovation Center is hosting this event. We have been in existence since 2019, and we have tried to have an in-person meeting for the last 3 years, so we're really excited that we're able to pull this off and be here in person and virtually. So on behalf of the entire Maternal Health Learning and Innovation team, I am honored to welcome you to the 3rd Annual National Maternal Health Innovation Symposium. As I said, this is the first time that we have held this event in person, and we're pleased to be here with you and other maternal health advocates around the country and world at the Swiss Hotel in Chicago, Illinois. We're excited we can continue to offer our tradition of virtual access to learning, and we know that we have 1,000 people who have registered virtually to join the several hundred people here in Chicago for this important event, so yay. I also want to mention that we're very excited. We have a graphic illustrator, Sunny, who is here from See in Colors, and she is going to be drawing throughout the two-day event and will be flashing her sketches on the virtual platform throughout the two-day meeting. So thank you, Sunny. We're excited that you're here. I do have a few comments, and then I'm going to introduce Dietrich Epps, my colleague and friend, to give us an acknowledgement so that we can be present in this space and remember those who came before us. But I do want to comment about our COVID situation. Just briefly, we know that although COVID has created opportunities for virtual meeting, it's also taught us how to be more inclusive and more accessible. So we are pleased that we can continue to offer a virtual option because we know that has eliminated barriers for people to travel, and we can make this content available while we're meeting, and then it will be available 2 weeks after our event. We do have some special events for people who have traveled in person, including our reception this evening, and we are sorry that our virtual attendees won't be able to participate in some of the in-person activities. I do want to mention that we would never be here if it wasn't for the hard work and dedication of so many of the people on the Maternal Health Learning and Innovation team, and you probably met them. They're standing in the back because I told them to come in and not be at the registration table. So I want to recognize Allison George and Tamala Grissett, Lynn Tompkins, Kelsey Accordino, and so many others who made this event possible. So at this time, if you're in the room and you represent the Maternal Health Learning and Innovation Center, can you please stand up just to be recognized? And this was an especially challenging year because our training coordinator, Alice, left us for another job opportunity in April, so we were really pushing to pull this event together. So great job for all of you back there. So a few housekeeping notes. For people who are here in person, any questions about the symposium, please look for the individuals who are wearing the yellow lanyards. We are happy to assist you throughout the two-day meeting. Otherwise, you can go straight to the registration table in the foyer and ask for assistance. We are asking that if you experience any COVID symptoms while you're here, or you test positive for COVID while you are here at the conference or shortly thereafter, to please contact Dr. Allison Stubbe on our team. She has given us her mobile number. It's at the registration desk. And we mostly want to be able to make sure that you're okay, first and foremost, but then also let others know that there may be an exposure to COVID. And we've tried really to ensure the safest environment possible. We're strongly encouraging masking. We required vaccinations in order to attend in person. But we are still in a high transmission area in Chicago, and so people who are here may get sick, and hopefully not very sick. And we do have a lactation room for anyone who's nursing. It's the Lugano room, and registration folks can show you where that is if that's something you need. So with that, I will be up and down. I get the privilege of introducing all of our wonderful presenters this morning. And firstly, we want to understand the longstanding history that brought us here to convene in this place, and to understand our place within that history. So to ground us in this space and in this moment, I'm honored to introduce Dietrich Epps, who will lead us through an important acknowledgement. And I'll just say a few things about Dietrich. She is founder and CEO for Race for Equity, and she is one of our partners with the Maternal Health Learning and Innovation Center. She brings 25 years of experience providing education, training, and technical assistance to health and human service providers and education leaders to help them use evidence-informed strategies to improve individual and community well-being. Her work has included capacity building and direct support for leaders to implement data-driven decision-making using the results-based accountability framework. And she also works globally with international agencies to advance culturally and linguistically appropriate strategies that achieve desired results. Dietrich and her team are important partners with the Maternal Health Learning and Innovation Center, and we value their contributions greatly. So I'm pleased to bring Dietrich to the podium.
Thank you. Hello, everyone. I have the great pleasure and honor to share with you in this moment. As Dorothy stated, we want to be grounded in this space of what it means to advance equity in maternal health. And part of that means coming together and acknowledging what brought us to this moment, right? How did we get to this space of inequities? And so I'm inviting everyone in the room and virtually to come together with us in this acknowledgement. And I'll ask you if it's okay. I'll explain to you what it is first. I'll ask you if it's okay if we do it together, because where there's unity, there's strength. And then we will move forward into the acknowledgement and honor. So first of all, acknowledgement is a simple but powerful way of showing respect. It can help us to correct some of the stories that have been erased in our country's history and in the global history. And this especially is true of Indigenous people. The more I learn and connect with Indigenous people, the more I recognize that we've got to pull those stories forward and understand why they are also experiencing inequities, especially in maternal health. So we're going to move today toward inviting and honoring the truth that are so critical in building mutual respect across all of our cultures, across all of our heritages of differences. That's what we're going to move into now. So we're going to start our time together by acknowledging what has been buried and by honoring the truth. So would you be willing to do this? If you're willing, do a thumbs up. You can do it virtually. You can do it also in person. Thank you, everyone, for your thumbs up. So I'm going to read through this acknowledgement and honor, and I invite you to think about the people you're representing here today, not just the people that are in your families, but also the people in your communities, right? So if you choose to do this acknowledgement and honor in your local area, I also ask you to think about who are the people and the populations that make up those individuals that you're standing in service of and working in service of. So every community owes its existence and vitality to generations from around the world who contributed their hopes, dreams, and energy to making the history that led to this moment that we're together here today. Some people were brought here against their will. Some were drawn to leave their distant homes in hope of a better life. Some have lived on this land for more generations than can be counted. So all of us make up those people, right? We all make up those people. So here today in Chicago, we're standing on the ancestral lands of the First Nations people. If you are part of those First Nations people from Chicago or around this area, would you be willing to stand and we can recognize you? So those today, we ask you to hold them in space and in mind because they're absent from the room. So Race for Equity is about, the RACE is an acronym that stands for Results Achieved Through Community Engagement. So we notice the absence and we commit to doing something about it, to including the voices of Indigenous people in this work. But we pay respects to their elders, past and present, and we honor and pay respect to our ancestors who helped to build this county, this state, and this nation that we're in today. So I'm asking you, if you are familiar with the Indigenous people from your community, take a moment, hold them in thought, hold them in mind, hold them in heart, and you might even jot down the name of a tribe that comes to mind for you at this time that you're committed to. I bring to mind the Halawassaponi tribe of North Carolina, of which the Richardson family is a part, and my grandmother was Dorothy Richardson. So when you learn your history, you know your history. When we learn our history, we do better. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today in this space as we move forward to advance equity for all. Thank you so much.
Thank you so much, Dietrich. Yes. We'll take a minute just to pause.
Can we go to the previous slide for a moment? Because there was a slide added. I want us to acknowledge the tribes of this community, which is so critically important. Thank you, Dorothy. I appreciate it. Sure. This is so important. We had there was an additional slide, and I want to actually point out the tribes of this area so that we can see them, acknowledge them, and know their names. So thank you for this time.
Okay, I was actually reading something Northwestern University is on the Council of Three Fires, and they actually have a dedication on their website as well. So appreciate that we were able to take a few minutes to acknowledge those particular tribes. Okay, so we're going to now move forward with our sponsors, our HRSA partners. As you all know, we are experiencing a devastating crisis in maternal morbidity and mortality in this nation, fueled by inequities rooted in racism, oppression, and rural-urban disparities. The Maternal Health Learning and Innovation Center's vision is to be an exceptional national resource center for eliminating maternal health inequities and improving well-being for all communities and families in the United States. Our mission is to foster collaboration and learning among diverse groups and organizations as yourselves to accelerate equitable maternal health outcomes. And this annual symposium is one way that we provide an opportunity and forum for maternal health professionals and other advocates invested in the well-being of women, birthing people, families, and communities to connect and learn, recharge, and build skills to ultimately achieve maternal health equity. So the work of the Maternal Health Learning and Innovation Center and this very symposium would not be possible without all of our presenters who have volunteered to put together the workshops for the next 2 days, and the federal support that we receive from the Health Resources and Services Administration, in particular the Maternal and Child Health Bureau, and we appreciate that we have partners from the Bureau here with us this morning. So known as HRSA, This agency supports programs that provide equitable health care to people who are geographically isolated and/or have economic and medical needs. Services are provided, for example, to people who are living with HIV, pregnant people, mothers and their families, those with low incomes, American Indians and Alaska Natives, and those who are otherwise unable to access high-quality health care. HRSA programs also support health infrastructure, such as workforce training and professional development, which is why we were fortunate to achieve funds to establish the Maternal Health Learning and Innovation Center. So today, we are honored to have HRSA Administrator Carol Johnson and Dr. Michael Warren, who's the Maternal and Child Health Bureau Associate Administrator, join us virtually. I'm going to introduce both of them, and then Carol Johnson will go first, followed by Dr. Michael Warren. So Carol Johnson is the administrator of the Health Resources and Services Administration, which is the federal agency in the U.S. Department of Health and Human Services focused on health equity, supporting healthcare services for historically underserved communities and working to build a robust and diverse healthcare workforce. Carol Johnson joined HRSA from the White House COVID-19 response team, where she led mitigation and surge response efforts. She previously served as commissioner of the New Jersey Department of Human Services, leading the state's largest agency and providing health care and social services to 1 in 5 people living in New Jersey. During her tenure, she expanded Medicaid coverage of mental health and substance use disorder services. She created new Medicaid benefits to improve maternal health outcomes, and she substantially increased child care rates for the first time in a decade, including expanding food assistance benefits. She also served more than 5 years in the Obama White House, working on implementation of the Affordable Care Act, combating the opioid epidemic, responding to public health challenges like Ebola and Zika, and advancing public health priorities. Johnson spent several years on Capitol Hill as a health staff, and she was a previous program officer with the Pew Charitable Trust. Dr. Michael Warren is the Associate Administrator of the Maternal and Child Health Bureau, which is also part of the U.S. Department of Health and Human Services and the Health Resources and Services Administration. The mission of the Maternal and Child Health Bureau is to improve the health and well-being of America's mothers, children, and families. Its Title V Maternal and Child Health Services program serves 93% of all pregnant individuals, 98% of all infants, and 60% of all children in the U.S., including those with special health care needs. Before assuming his current role as the Maternal and Child Health Bureau Associate Administrator, Dr. Warren served in various roles in Tennessee. At the Tennessee Department of Health, he was the Deputy Commissioner for Population Health, the Assistant Commissioner for Family Health and Wellness, and the Director of the Maternal and Child Health Program. So we're very excited to welcome both of them to our program.
Great. Thank you so much, Dr. Shinley, and thank you to all of the participants for the opportunity to be with you today. I'm Carol Johnson. I am the Health Resources and Services Administration Administrator, and I am delighted to be here with Dr. Michael Warren, who runs our Maternal and Child Health Program and is just a wonderful leader in this space. It is timely to be having this meeting at this moment. I had the opportunity recently to travel with the Vice President and the head of the Centers for Medicare and Medicaid Services to Illinois for the rollout of the White House's Maternal Health Blueprint. There's no greater advocate or real leader in focused on what we need to do to advance maternal health and improve health outcomes for women of all races and demographics than the Vice President. She is completely dedicated to this issue and has raised it repeatedly with us. We will talk a little bit about some of the work that we're doing here at HRSA, and much of that is because of Michael's leadership, but the Vice President has really helped create a framework in which we are able to get the support and resources we need to execute on what we know are the critical steps we need to do here. You know, part of what we're focused on is really, you know, at HRSA, we really are a federal agency whose mission includes improving the health and well-being of pregnant individuals and their children. And we're, you know, focused on what are the best practices and the actions that we can take to help advance that goal. And, you know, it is unacceptable that in the United States today, that Black women are 3 times more likely to die from pregnancy-related complications, that Native American women are twice as likely to die. The people who live in rural America are 60% more likely to die. These disparities in outcomes are just unacceptable, and we need to change path. We need to do better. And that is what across the Biden administration we're committed to doing, is what Secretary Becerra has charged us at HRSA, our colleagues at CMS, our colleagues at SAMHSA, you know, all across the Federal Department of Health and Human Services, to really work together to address the challenges in the system. You know, the experience and the loss is devastating to individuals, but it should be devastating to us as a nation to know that there are things we can do to address that, and there are tools at our disposal, and we need to take advantage of them, and we need to be investing in them and doing that work going forward. But I will say it is also also true, and I want to recognize that this isn't work that has materialized overnight. We're able to, as a federal agency, work with our colleagues in Congress to advance new initiatives here, because we're standing on the shoulders of the work that you've been doing for decades. We know how much progress has been made in maternal health, and we know how all the evidence base has been built by the work that you've been doing. So we're grateful, incredibly grateful to you for that work, and stand with you in the work going ahead. And part of that is by making the resources available to support that work. So the president's budget for this upcoming fiscal year proposes an almost $500 million investment for us at HRSA to expand our maternal health initiatives. And that really is focused on, we think, across the spectrum of the challenges we're facing here. So starting with the data, right? It's essential that we have the right information and we understand root causes, and that we're working together to support to bringing all the information that everyone has together around the table. And so one of the things Michael and his team have been doing is incentivizing the creation of state task forces that really bring all the players together in the state, not just thinking about what the health department might have, but what the Medicaid agency has, information and data that our SNAP colleagues have, information and data that our justice involved colleagues have, information and data that managed care plans have, to help fill out the complete picture so that we understand the inputs and that we can better drive the outcomes. But then also focused on the system. We all know that there's implicit bias in the system. We all know that there's structural racism that has driven some of these outcomes. How do we begin to address that in ways that are meaningful and can produce real actionable outcomes? And so there's new investments in our budget to support implicit bias training for maternity care providers, so that we can begin to address these critical issues. And thinking about what are the ways in which we can work towards overcoming implicit bias through training, but we also can work to make sure that the healthcare system is centered around pregnant people's needs and their voices. And so that is why our budget also invests in the training and support for community-based doulas. You know, there is a wealth of experience in the community for what it takes to deliver, to ensure that women's voices are heard. And doulas are a critical part of that work. And so we're really honored to be in a place where, if these resources come through, we can continue to expand the work that we have begun in this space, because we know that the workforce is critical to delivering on the outcomes that we want to see. So that also includes new investments proposed in our budget to expand the midwife training and midwife supports as well, because again, We need a workforce that's centered around women's needs and women's voices and supporting women's outcomes. We also, but also in the clinical setting, are focused on strategies like pregnancy medical homes. Medical homes have been a model that's been around for some time, have been exercised and worked in the primary care space, and really thinking about how we build that out in the maternal care space is a really exciting opportunity, and again, a place that we hope to secure additional resources. But it's not just about what happens inside the clinical walls. And I imagine that that is something everyone on this call, in this meeting, would agree with, and have example after example of the fact that that the community that people, the environments that individuals live in, their access to transportation and food supports and housing and when necessary, domestic violence supports, like the kinds of things that make it possible for people to actually get the kind of care they need and then live and work and play in healthy environments, are part of what is going to help us address the outcomes that we need here. And so again, what our plan includes new investments in working to address the social determinants of maternal health, and really working at the community level, so that while there's critical work that's happening at the clinical level, and we're building out a workforce and building out medical homes and building out those tools, that we're also thinking holistically about what the experience of trying to access maternal care is like for women in their communities, and how we can ensure that those tools are there, and that we're addressing any barriers that limit and make it harder for women to get the outcomes that they need. But there's so many other critical issues in this space, right? There's the Dobbs decision. There's the fact that the child tax credit makes such a meaningful difference in families' lives, and there's more work to do to revitalize that work. But for purposes of today, I will try to stay focused on the critical needs around the maternal health workforce and the maternal health strategies that we are pursuing. I will say that the administration's maternal health blueprint gives sort of a structure to some of the topics that we've talked about so far. It is really focused on data and care systems and the community, and so much of the work that the way we've built out our work kind of tracks along how the blueprint is designed. But there are other things that we continue to support at HRSA that we think are so critical to this fight, and some of those are about the mental health and well-being of pregnant people, and both prenatal and during pregnancy and postnatal. And so we have launched a 24-hour, 7-day-a-week toll-free hotline, which is our national maternal mental health hotline. The phone number is 833-9-HELP-4-MOMS, help the number 4 moms, to really be sort of a safe space and resource for expectant moms and those who have recently delivered, to be able to get the kind of expert support that they may need, and to also help refer people who need more than just that phone call. But I see this as a little bit of a piece of with our work on expanding access to community-based doulas and midwives, and creating implicit bias training, like really we need to create those spaces where women's voices are heard, and where women can access the supports that they need. And our mental health hotline is one of those tools, as is our maternal screening and depression program, where we are also working to train the maternal health care workforce in recognizing and identifying mental health and substance use disorder needs, and really helping that front, so that there's no wrong door, really helping that frontline maternal health care workforce to understand and identify maternal depression and the supports that are needed, and where those cases are more complex than a maternal health provider may be able to manage, providing real-time, close to real-time teleconsultation to a team of mental health experts to be able to support that mental health provider in meeting the needs of their patient. What we have anecdotally found is how critical that time is. Again, this all of these things tied together as we think about social determinants of health. If a patient presents to a maternal health provider with the indication of having some mental health concerns, and that mental health provider doesn't have the capacity to respond to them and needs to refer them somewhere else in the community that might be hours away, or might not be hours away, but might be 3 buses away and another day out from your job, that all of that makes it harder for pregnant people to get the care they need. If we can move that mental health support into the maternal care setting, and be able to support maternal care providers in meeting those needs, that's what we want to do. And so that's a critical program that Michael and his team have stood up. We are anxious to continue to expand it. We're in a couple of states now. We want to be in more. But we know that the mental health needs that all of us, frankly, over the last 2+ years, everyone has had some experience with mental health challenges related to what we've all experienced through COVID. So we all now have a sense of how important having access to the services that we need is, and all the more important for the maternal for pregnant people, as we have long known that maternal health needs and maternal depression is something that we need to be addressing. So we know the challenges are real. We know that the experience that women have today is not what we want it to be. We know that we need to do better. And we're committed to working with all of you on the policy solutions, on the changing the culture solutions, on the what it takes to be leaders for our nation to turn this around, so that this country can be the safest place to deliver a baby. And so with that, I will turn it over to Dr. Warren, who will talk in more detail about some of our programs. But thank you all for the work that you're doing. And thank you for this partnership as we continue to move forward to address this critical challenge.
Thank you so much, Administrator Johnson. I'm so delighted that folks had the opportunity to hear from you. For those of you who are watching either live or virtually, we are so fortunate to have Carol at HRSA, not only with her experience at HRSA and so understanding the agency well, but also her really rich experience in states, just like where all of you are trying to implement your maternal health innovation activities to really understand what does that federal state partnership look like and how do we support folks in working together. So Carol, so glad you could join us and thank you for being here. We are thrilled to convene you all in partnership with our colleagues at the University of North Carolina and the Maternal Health Learning and Innovation Center for this national symposium focused on maternal health innovation. I want to spend a little bit of time talking with you about some of the work we've got going on at the national level. Carol hinted at some of that. It's a really exciting time. And for us in the Bureau, it builds on our strategic plan launched last year. We've got 4 key goals: access, equity, capacity, and impact. All of those relate across our portfolio, but in particular for this conversation, all of those relate to improving maternal health. So you will see those elements baked into all the funding opportunities and all the work that we're doing with partners in states and communities and across the federal government. We also have been thinking about this paradigm of accelerate upstream together. Carol talked about the unacceptable current statistics with regards to maternal health. So when we recognize the fact that over 800 women die every year within the first 6 weeks after pregnancy, about 24 out of every 100,000 live births, that is unacceptable. Also unacceptable that there are the marked disparities, and those disparities, those inequities have persisted. They aren't new. And so if we're going to change things, it's not just enough to say we've got to commit to do that. We're going to do it over the long haul. We have to accelerate that pace of change. We have to eliminate those as quickly as we can. And so we're committed to doing that. We do that by working in innovative ways with partners just like all of you. And we're going to share some examples of how we've been doing that. But so much of that work happens upstream, thinking about those broad determinants of health. So absolutely clinical care is important. It is necessary, but it's not sufficient. We know that clinical care only accounts for about 10 to 20% of a person's overall health and well-being. And so thinking about those social determinants, those factors in the environments where we live and learn and work and play, but also those structural determinants, policies, governing practices, factors like racism and bias and discrimination. Those structural influences actually influence how folks experience the social determinants of health, which influence those health outcomes. So we've got to think upstream and got to think about how our work really pulls on those social and structural levers. And finally, the last part of this paradigm is we do this together. We as a federal agency can't do this alone. We can't do this just in partnership with other federal agencies. We have to work with folks across the country, including all of you. And importantly, we have to include folks with lived experience. They're not just the recipients of our services. They really should be driving what we do and how we do it. So pulling them to the table pre-decisionally to understand what is it they want, what is it they need. They are the experts in their own lives and what they need to be able to thrive. And so being able to incorporate them into that work is absolutely essential. So as we think about this framework of Accelerate Upstream together and how we're doing that, one of the ways we've been focused on doing that is through our AIM initiative, the Alliance for Innovation on Maternal Health. This is familiar to many of you. These are those safety bundles or toolkits of practices that have been shown to reduce morbidity and mortality when they're implemented in clinical settings. Things like addressing hemorrhage or management of hypertension. Some of the original bundles, those have grown over time to include things like substance use disorder. So tools that are available for practitioners to use across a variety of clinical settings. This program has continued to grow. I'm excited to say we're now in 45 states plus the District of Columbia. Just in the last quarter, we've added Minnesota. So kudos to our colleagues from Minnesota who may be joining. Thanks for moving into the AIM space. As you can see, we've got 5 states that remain to fill out our map. So North and South Dakota, Wyoming, Idaho, and Arkansas. If you are from one of those states and you're ready to make that move to be an AIM state, please reach out to us. We'd be happy to move that along and happy to work with you to help fill out this map. So more than just filling out the map, it's important to say what folks are doing in those AIM states. And just want to give a shout out to a couple of state bright spots. The first in Oklahoma. This is an example of what states can do when they engage their birthing facilities in quality improvement. So Oklahoma has an Every Mother Counts initiative. And as part of that initiative, they recognized that they wanted to focus on management of severe hypertension. And so they looked at those protocols for what happens when a person has an elevated blood pressure reading. And what they saw through a very focused effort, through a concerted engagement with partners, was that they were able to increase the percentage of patients who got timely care. So within 60 minutes of an elevated reading, getting that person to timely care. And they saw that 50% increase over the course of implementation of that AIM bundle. Just tremendous work around an issue, hypertension, that we know has important and serious outcomes for both mother and baby. Similarly, our colleagues in New York recognized that they really wanted to focus on substance use disorder. So they used the AIM opioid use disorder bundle and looked at making sure that patients were connected with medication-assisted treatment or behavioral health therapies prior to discharge. And so among the pilot sites that were participating, they increased those from 72% of patients achieving that outcome to 93%. So important when we think about those behavioral health drivers and those the ways that behavioral health conditions contribute to both maternal morbidity and mortality. So kudos to Oklahoma and New York. We could have shown any of a number of states. Folks are really doing tremendous work across the country with those AIM bundles. But that work is not just limited to clinical settings. So we recognize that so much of health happens outside of hospital and clinic walls. And we've got to think about what happens in communities and how do we make those communities healthy. So a few years ago, we started funding something called AIM CCI, the AIM Community Care Initiative. Our question was, could we do something analogous to those AIM bundles that typically have happened in hospitals and clinics, but could we apply that bundle approach to community settings? And so really pleased with the work that's been happening to date on this. Wanted to let you know that one of the things they've released most recently is this Racial Equity Learning Series. This is a series of 7 modules that can be used by folks who are taking care of pregnant and postpartum people. as a way to help us better understand some of those drivers of inequity and what we need to do to address them. And address them not just as individuals, but thinking the personal level, our institutional level, and then at the systemic level. So this series can give you the tools to do that. Also want to make sure I point out this is free, and not only is it free, you can get continuing education credits. So if you are like me and you've got an annual requirement for continuing education to keep your license, it's important to think about where those opportunities are. You can get credits both on continuing medical education, continuing nursing education, as well as for certified health education specialists. So I encourage you to check that out through our AIM-CCI initiative. We also know that many of you participate in activities related to our state maternal health innovation grants. So we currently have 9 grants funded, excited to be able to expand that with some of the budget increases that are coming that Carol mentioned. And this funding really is about creating resources for states to pull together a maternal health task force to examine all sorts of surveillance data related to maternal health, and then engage in innovative strategies that are responsive to those state-specific data. I just want to call out a couple of examples. Our colleagues in Illinois have done some great work around 2-generation clinics. The stories of individuals and the quotes from them tell this work much better than I can. And so you see this quote from a mom on the screen who said she wished that the service was around when she had her first baby. The clinic helped her find a place to live and also have someone to talk to when she got frustrated. So again, thinking about those social determinants of health like housing, thinking about those contributors to health and well-being like behavioral health. Great example from our colleagues in Illinois about how to integrate these services and to do it in a way that's serving both mom and baby. Similarly, our colleagues in Montana have recognized unique challenges that they have as a state with large frontier and rural populations. So they've used some of their maternal health innovation funds to think about mobile simulations, where they actually go out to facilities in rural and frontier regions. And that state births in those hospitals that are not considered birthing hospitals, but they're in rural and frontier areas. They actually account for 20% of all the deliveries in Montana. So they recognize the great need to be able to go out and do the simulation. And it is so timely. So this quote from a physician who noted that his facility had this SIMS training, the simulation training, and within a week of that, had a patient with the worst hemorrhage they had seen in years. Their simulation had in fact been on hemorrhage, and he reports seeing a marked change in the way that the staff responded to that compared to the way they had responded before, and that because of the simulation, they were much more prepared. So our MHI grantees across the country are really making important strides in this work and helping to address these drivers of maternal mortality and morbidity. Now, Carol mentioned our brand new maternal mental health hotline. We were so excited to launch this on Mother's Day weekend. Again, to reiterate that number, 1-833-9-HELP for moms. Folks can either call or text that line 24 hours a day, 7 days a week, and speak to a licensed counselor. We also have some resources. We've been getting questions about how to promote the hotline. And so on this slide, you'll see some examples of some of the promotional materials that can be shared via social media. Also printable wallet cards, text that you can put in newsletters or flyers. And over the course of this year, we hope to have a resource in place so we can actually be able to provide some of those materials to you already printed. In the meantime, you can download them from our website and print them and share with the folks that you work with. Carol also mentioned the work that's being led at the administration level, so the president and vice president, and the recent launch of the White House blueprint for addressing the maternal health crisis. There are 5 pillars in this blueprint. Those focus around access, giving a voice to patients, data, workforce, and strengthening economic and social supports before, during, and after pregnancy. So much of the work that we are doing is driven by this blueprint and aligns with that blueprint. If you haven't seen it, I encourage you to do it, but I think just speaks to the high level of commitment that we have from this administration to move this forward. Also wanted to just give you a quick heads up on a couple of funding opportunities that we will be posting in the near future. These are things we will fund in fiscal year 23. We will be completing our AIM, our Alliance for Innovation in Maternal Health state capacity program, thinking about how we give tangible resources to states to be able to grow this AIM work. We'll also be funding a National Technical Assistance Center to be able to support AIM. And as Carol mentioned, we've got our Screening and Treatment for Maternal Depression and Related Behavioral Disorders program. This facilitates that teleconsultation for folks in primary care and maternal health care practices to be able to access resources that may not exist in their community. We'll be recompeting that in fiscal year 23, and we hope if the budget comes through, we'll actually be able to fund more states than we are currently funding. So a lot going on. I just want to end by saying we know that none of this would happen without the great work that you all are doing. These things don't happen by chance. They happen in direct result of the partnerships that you all are forming at the community and state levels, and the great ways that you're making use of these resources. So thank you for the work that you do every day. Thank you for your ongoing commitment to mothers, children, and families in our country, and look forward to spending the rest of the time with you. Thank you.
Thank you so much, Carol and Michael. We are so fortunate to have your leadership and your support to do this important work.